Welcome to our StudiGuide course, First Aid and CPR. During this course, I will explain what will be covered and how it will be covered for your examination. You'll be able to identify primary responsibilities of peace officers as EMS first responders at a medical emergency, the links of the chain of transmission of infectious pathogens, conditions under which a peace officer is protected from liability when providing emergency medical services, assessment criteria for establishing priorities when assessing multiple victims at a single scene, the difference between a mild and severe airway obstruction, indicators of shock, appropriate first aid measures for treating injuries to the bones, muscles, or joints. You'll be able to distinguish between the two primary bleeding control techniques. You'll be able to differentiate between indicators and first aid measures for treating insulin shock or hypoglycemia or diabetic coma hyperglycemia. You'll be able to differentiate between the indicators and first aid measures for treating hypothermia and frostbite, heat cramps, heat exhaustion, and heat stroke. You'll be able to recognize precautions peace officers should take to ensure their own personal safety when responding to an emergency, conditions under which an injured victim should be moved from one location to another, proper procedures for moving a victim, circumstances under which a victim's airway should be opened by using a head tilt chin lift maneuver and jaw thrust maneuver, indicators of a possible head injury, the appropriate first aid measures for treating injuries to the head, appropriate first aid measures for treating open and closed injuries to the chest and abdomen, appropriate first aid measures for treating thermal, chemical, electrical, and radiation burns, appropriate first aid measures for stings and bites, the signs of imminent birth, appropriate first aid measures for each of the following emergency situations that may occur in childbirth, such as excessive vaginal bleeding and newborn fails to breathe. You'll be able to recognize indicators of and first aid measures for a victim experiencing cardiac emergency, respiratory emergency, drowning, seizure, and stroke. So the following is just information which you will perform or demonstrate in class and not likely to be presented in the written examination. You'll be able to perform procedures for clearing an obstruction from the airway of a conscious and unconscious adult, child, infant, pregnant, or obese individual. You'll be able to perform first aid measures to treat shock. You'll be able to demonstrate appropriate actions to take during primary assessment for assessing a conscious victim's responsiveness, airway, breathing, and circulation. You'll be able to demonstrate appropriate actions to take during a primary assessment for assessing an unconscious victim, such as responsiveness, breathing, circulation. You'll be able to demonstrate cardiopulmonary resuscitation, CPR, for adults, children, and infants, including ventilation duration, pulse location, compression depth, compression rate, compression to ventilation ratio, or one-person CPR, or compression to ventilation ratio, two-person CPR. You'll be able to demonstrate rescue breathing techniques when using a pocket mask, bag valve mask, or mouth-to-mouth maneuver with a barrier device. You'll be able to demonstrate the general guidelines for controlling bleeding from an open wound. This is more than likely all you'll be tested on during this specific written examination.